And as the president gets ready to name his Supreme Court pick, some are wondering about the impact his choice could have on health care and what would happen if the high court ends Obamacare. Joining us to discuss, Den Bishop, the president of Holmes Murphy Insurance Brokerage, also author of the new book, The Voter's Guide to Healthcare. Den, thanks for coming on today's show here. If the president moves ahead with announcing his nominee, which he plans to do, as we heard, this Saturday at 5 p.m., and the Senate goes ahead to confirm the vote the vote to confirm the justice, how would another conservative justice impact health care as we know it?
Well, we could have a situation where elements or the entire Affordable Care Act was overturned. A key issue with that and where the justices are split at this point is on the issue of severability. So could the court, in essence, say yes, elements, particularly the element of the individual mandate? Would we see a conservative court potentially throw out the individual mandate completely? I think we could. What I don't anticipate happening is anything where the pre-existing condition protections that Americans appreciate go away, whether that was with an overturn or not. Virtually every idea that comes down still has those pre-existing condition protections protected.
Which is something that the president had said he would do himself to protect those with pre-existing conditions. So interesting to hear, again, your analysis of this as well. I do want to note, though, that some top health officials are taking some heat for drawing a blank when asked about the president's plan to replace Obamacare. Listen to this.
Does a replacement plan exist that you are aware of? Any of you? Yes or no? Admiral?
I'm not involved in the replacement plan. I don't know what that is. I supply public health advice as much as I can for whatever that plan would be.
Dr. Kadlec, are you aware of such a replacement plan?
Sir, it's not in my portfolio, and sir, honestly, I've been so busy with the other things, I have no awareness of that. It may exist.
Dr. Redfield, are you aware of a replacement plan?
Again, it's really not in my main lane.
So to be fair, a lot of these faces in that hearing, they've been working extensively on dealing with the coronavirus pandemic in our country, and maybe not exactly the Trump health care plan. But the fact that they are not aware of it, is that at all concerning to you?
Well, it could be. In my book, in tongue-in-cheek, I say the Republican plan at times has been repeal and erase because there hasn't been a strong consensus on what a plan should be. What we can do is look at what the Trump administration has tried to accomplish in healthcare, and they've even said that much of what's in their plan is already out there. So what's out there are consumer choice, more transparency. They've been trying to get to transparency, protection of pre-existing conditions. And I think the biggest item and where we will see this would be in an executive order that President Trump had around pharmacy pricing. And my opinion, not being part of the administration, not being part of the discussions, is that pharmaceutical pricing issue would probably be among the biggest items in whatever this plan is. That has been forecast.
Yeah, we've covered the president's plan to lower prescription drug prices here on this program as well. Den Bishop joining us live this morning here on National Report. Den, thanks so much.
Thank you very much.